Imagine this. You wake up in the morning, stretch, maybe enjoy a cup of tea or coffee, and start your day. But lately, you've noticed something. Perhaps your memory isn't quite as sharp as it used to be, or maybe you're feeling more forgetful, more foggy than usual. You might even feel a little more tired, a bit more sluggish, or find yourself asking, why am I not feeling like myself anymore? It's a common experience for many of us as we age. We're told that slowing down, feeling a little forgetful, or not bouncing back as quickly is just part of getting older. But what if I told you that some of the medications you take every day, medications that are supposed to help you stay well, might actually be working against you? That hidden within those pills could be dangers you never knew about. Dangers that could affect your brain, your memory, and your overall mental health. Now, I know this might sound alarming, and it's natural to feel a bit worried. But the good news is, once you understand these risks, you can take steps to protect yourself. You can become more aware of what's happening inside your body, ask the right questions, and make smarter choices about your medications. That's what we're here to explore today, because you see, many seniors are taking multiple medications, sometimes called polypharmacy, which can increase risks. And some of these drugs, even when prescribed with good intentions, can have side effects that quietly chip away at your brain health. It's not about scaring you, it's about empowering you. Knowledge is power, especially when it comes to your health. So, let's start by talking about what these hidden dangers are. What exactly are they, and how do they sneak into your system? And more importantly, what can you do about it? We're going to cover some eye-opening truths today, and I promise by the end of this you'll be better equipped to protect your mind and your future. Now, I want to begin with a question. Have you ever noticed feeling more forgetful after starting a new medication? Or maybe you felt more dizzy, more tired, or even a little confused? Well, these aren't just coincidences. Sometimes, the medications meant to help us can have side effects that affect the brain in subtle but serious ways. One of the most common culprits is a class of drugs called anticholinergics. These are often found in medications for allergies, sleep aids, or even some medications for bladder problems. The trouble is, they block a chemical in your brain called acetylcholine, which is crucial for memory and learning. When this chemical is blocked, it can lead to confusion, memory troubles, and even a higher risk of dementia over time. Think about it like this. If a medication is interfering with the communication lines in your brain, it's like cutting the wires to a telephone switchboard. Messages don't get through clearly, and over time, that can really impact your mental sharpness. And it's not just anticholinergics. Many medications for pain, depression, or even certain heart medications can have side effects that affect your brain function. Sometimes it's a matter of dosage, sometimes the combination of drugs, and other times it's how your body processes these medications as you age. Another example is benzodiazepines, drugs often prescribed for anxiety or sleep problems like Valium or Ativan. While they may help you fall asleep or feel calmer, they can also cause memory problems, balance issues, and even an increased risk of falls. And falls are a serious concern for seniors, often leading to injuries and hospitalization. But here's the thing. These medications aren't inherently bad. They're vital for many health conditions. The key is understanding their effects and how they interact with your body. Sometimes the medication isn't the villain. It's how it's used, how much, and whether it's the right fit for you. That's why it's so important to have open conversations with your healthcare provider. Ask questions like, is this medication necessary? Are there alternatives? What are the side effects I should watch for? And don't be shy about sharing how you're feeling, your symptoms, concerns, anything that seems unusual. Now let's talk about another hidden danger, the combination of multiple medications. It's common for seniors to be on several drugs at once, things like blood pressure pills, cholesterol medications, diabetes management, and more. While each of these might be fine on its own, together, they can cause unexpected interactions. Some drug combinations can amplify side effects, leading to confusion, dizziness, or even cognitive decline. For example, combining certain blood pressure medications with antidepressants can sometimes cause a drop in blood pressure too low, making you feel faint or disoriented. Or, Taking medications that cause drowsiness along with those that impair coordination can increase the risk of falls and injuries. It's like a delicate dance, trying to balance multiple medications without upsetting the harmony. And sometimes the side effects are subtle, like feeling unusually tired or forgetful. And you might not connect these feelings to your medications. So, what's the takeaway so far? First, always be aware of what you're taking and why. Second, don't hesitate to ask your doctor or pharmacist about potential side effects, especially those that could impact your brain health. And third, keep a list of all your medications, including over-the-counter drugs and supplements, and review it regularly. Because the truth is, many of us trust that medications are safe because they come from our doctors. But the reality is, side effects can be sneaky, and the more we understand, the better we can protect ourselves. Sometimes adjusting the dose or switching to a different medication can make a big difference. As we move forward, I'll share more about specific medications to watch out for and practical steps you can take to safeguard your mental well-being. But for now, remember this: being informed is your best defense. Your brain is precious, and taking control of your medication choices is a powerful step toward preserving your memory, your independence, and your quality of life. So stay tuned. There's more to learn, and I'll be right here with you, helping you navigate this complex world of medications and health. Because at the end of the day, it's about you, your health, your happiness, and your future. Now that we've begun to uncover some of these hidden dangers lurking in our medications, I want to share more about what to watch out for and how you can take proactive steps to protect your precious brain. Because knowledge is power, and understanding these risks can truly make a difference in your daily life. Let's start with one of the most common and underestimated culprits: sleeping pills, or what doctors often call hypnotics. Many seniors turn to medications like Ambien or Restoril when sleep becomes elusive, and I get it. Sleep issues can be really frustrating, especially when you're trying to stay active and enjoy life. But here's the thing: those pills can do more harm than you might realize. These drugs, while effective at helping you fall asleep, can cause memory problems and confusion the next day. You might wake up feeling groggy, disoriented, or even with a headache. Over time, they can interfere with your natural sleep cycle, making it harder to get restorative rest without pills. And in some cases, they can increase the risk of falls during the night, especially if you get up to go to the bathroom and feel unsteady. It's a delicate balance. Often, people don't realize that these medications can contribute to a kind of brain fog that worsens over time. The good news is, there are safer ways to improve sleep. Establishing a calming bedtime routine, reducing screen time before bed, and creating a comfortable sleep environment can often help more than medication. And if you do need help, talk to your doctor about alternative options. Sometimes, non-drug therapies like relaxation techniques, gentle exercises, or cognitive behavioral therapy for insomnia, CBTI, can work wonders without the risks associated with sleeping pills. The goal is to find ways to help you rest peacefully without compromising your mental clarity. Another medication category that deserves attention are certain pain relievers, especially opioids and some anti-inflammatory drugs. While these can be essential for managing chronic pain, they can also cause side effects that affect your brain and balance. For example, opioids can cause drowsiness, confusion, and even impair your coordination, making falls more likely. And here's a little-known fact: even over-the-counter pain medications, like some high-dose acetaminophen or NSAIDs, can sometimes cause side effects that impact your mental sharpness, especially if taken long-term or in higher doses. It's always wise to review your medication list with your healthcare provider regularly and ask whether there are safer options or lower doses you could try. Now, let's talk about a very common medication that many seniors are prescribed: cholesterol-lowering drugs known as statins. While these medications can be very effective at reducing heart disease risk, some studies suggest they might be linked to memory issues or cognitive slowing in certain individuals. The science is still evolving, but it's worth having a candid conversation with your doctor about whether you really need to stay on these drugs or if lifestyle changes could do the job instead. It's important to remember that every medication has a benefit and a risk. The key is to understand those risks and weigh them carefully. Sometimes a medication that's been helping you for years might need to be reevaluated, especially if you're experiencing new symptoms like forgetfulness, confusion, or difficulty concentrating. Now, I want to emphasize one critical point. Don't ever stop or alter your medications without consulting your healthcare provider. Suddenly, stopping a medication can be dangerous. But what you can do is keep an open dialogue, ask questions, and work together to find the safest, most effective plan for your health. Another important step you can take is to be vigilant about side effects. Keep a simple journal or a list of any new symptoms you notice: memory lapses, dizziness, difficulty concentrating, or mood changes. Sometimes, these subtle signs are the first clues that a medication might be affecting your brain. And let's not forget about over-the-counter drugs and supplements. These are often overlooked but can have powerful interactions or side effects. For example, certain antihistamines used for allergies, like diphenhydramine, are anticholinergic and can impair memory and cognitive function, especially with long-term use. Always read labels carefully and talk with your pharmacist about the safest options. Now, I want to share a story. Imagine a lady named Margaret who was taking multiple medications for high blood pressure, sleep, and allergies. Over a few months, she started feeling more forgetful and unsteady. She thought it was just part of aging. But after a thorough review with her doctor, they discovered that her allergy medication was causing significant cognitive side effects. Once she switched to a safer alternative, her memory and balance improved dramatically. That's the power of being informed and proactive. So what's the takeaway? First, always stay informed about your medications. Second, communicate openly with your healthcare team. And third, don't hesitate to ask if there are safer or alternative treatments available. Your healthcare providers want to help you, and working together is the best way to safeguard your brain. As we continue this journey, I'll share practical tips to help you feel more in control of your health and keep your mind sharp. Because at the end of the day, it's about empowering you, helping you enjoy your golden years with clarity, confidence, and peace of mind. Stay with me, because there's more to uncover, and your brain health is worth every effort. Now that we've explored some of the hidden dangers lurking in your medications, I want to leave you with a few final thoughts. Simple, practical steps you can take starting today to protect your precious brain and maintain your independence. First, always be your own best advocate. You have every right to ask questions about your medications. Don't hesitate to ask your doctor or pharmacist why you're taking each drug, what side effects to watch for, and whether there are safer alternatives. Sometimes medications can be adjusted or dosage can be lowered without sacrificing their effectiveness. Remember, you are the most important part of your healthcare team. Keeping a detailed list of all your medications, prescriptions, over-the-counter drugs, vitamins, and supplements is a good habit. Review this list regularly with your healthcare provider. It helps prevent dangerous interactions and ensures that each medication is still necessary. If you're ever unsure, seek a second opinion or ask for a medication review. This is especially important if you've recently started new drugs or noticed any changes in your memory or mood. Next, be vigilant about side effects. Trust your instincts. If you notice that you're feeling more forgetful, dizzy, or unsteady, bring it up promptly. Sometimes, a simple change in medication or dose can make a world of difference. Your healthcare team wants to help you stay safe and sharp. Another powerful step is to focus on lifestyle habits that support brain health. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides your brain with the nutrients it needs. Regular physical activity, even gentle walking or stretching, boosts blood flow to your brain and helps keep your mind clear. Mental exercises, like reading, puzzles, or learning something new, can also strengthen your cognitive skills. And don't forget the importance of social connections. Staying engaged with friends and family can lift your spirits and keep your mind active. Now, I want to emphasize something very important. Don't be discouraged if you're taking multiple medications. You're not alone, and many seniors face similar challenges. The key is to stay informed, ask questions, and work closely with your healthcare providers. Sometimes just a little adjustment or a new approach can significantly improve your quality of life. Remember, your brain is one of your most valuable assets. It's the seat of your memories, your personality, and your independence. Protecting it doesn't mean avoiding medications altogether. It means being smart about how you use them. It's about understanding potential risks and taking steps to minimize them. And here's a hopeful thought. Small changes can lead to big improvements. Perhaps reviewing your medications with your doctor, making some lifestyle tweaks, or simply staying more aware of how you feel can help you regain control. You deserve to live each day with clarity, confidence, and joy. I want you to know that you are not alone on this journey. Many seniors are discovering these truths and taking charge of their health. The fact that you're here, listening and learning, shows your dedication to living well, and that's something to be proud of. So, go ahead. Ask questions, seek support, and make informed choices. Your future self will thank you. Keep nurturing your body and mind, and remember that age is just a number. Your spirit and your health are what truly matter. Beginning of a new chapter, one where you feel empowered, supported, and in control of your health. Because no matter what, you have the strength to protect your mind and live your best life at any age. Thank you for spending this time with me today. I hope you feel inspired, informed, and ready to take those small but impactful steps. Here's to living your best life, full of health, happiness, and peace of mind.